Different types of acupuncture and different types of acupuncture needle. Hello, I am Anna, the virtual assistant of Happy Live, and I will guide you through the video now. Please also pay attention to the description. There are different types of acupuncture. Whichever you decide to use, they are designed to do the same thing, and that is to relieve pain or treat certain diseases. The first is called TCM Based Acupuncture. Here, it uses 8 principles of complementary opposites to create harmony in the body. These include yin-yang, internal-external, excess deficiency, hot-cold. Next is called FrenchEnergetic Acupuncture. This is often used by MD acupuncturists. Meridian patterns are emphasized here, particularly the yin-yang pairs of primary meridians. Korean hand acupuncture is another, as practitioners believe that the hands and feet have concentrations of qi, and that applying acupuncture needles to these areas is effective for the entire body. There is also auricular acupuncture, where it is believed that the ear is a microcosm of the body. This means that acupuncture needles are placed on certain points on the ear so it can treat certain addiction disorders. Myofascially based acupuncture is often utilized by physical therapists, as it involves feeling the meridian lines in search of tender points before applying needles, as this is where abnormal energy flows. Japanese styles of acupuncture, referred to as meridian therapy, tend to put more emphasis on needling technique and feeling meridians in diagnosis. Impulses of electromagnetic energy can also be used, as the body generates tiny but electrical discharges which influence the function, growth and maturity of certain types of cells. By inserting the needles in these areas, it stimulates and alters the neurotransmitters in the body, thus making the patient feel better after treatment. This is also sometimes used for diagnosis and testing. There are also other forms of acupuncture that do not use needles. For instance, there is sonopuncture that uses an ultrasound device that transmits sound waves to points in the body to treat a patient. Some practitioners use a tuning fork or other vibration devices. Acupressure is another. Here, the professional will use their hands to relieve the pain. This can be used on its own or with other manual healing techniques. The number of treatments you will need depends on the patient's condition. On average, this could be from 10 to 5 treatments and 2 to 3 times a week. How much it will cost also varies, as this could be from $40 to $150. Some insurance companies and HMOs now cover that or partially, so you should check if this is included in your policy. By acupuncture to relieve pain or prevent one, but many practitioners decline to see someone during pregnancy. But if you have already started, it is generally safe to do so until the infant is born. Some acupuncturists may ask you to take in some herbs as part of the treatment. Since you have no idea what it can do, have this checked first by your local doctor to make sure this is safe, as this could interact with the drugs you are taking, causing side effects. Which type of acupuncture should you try? That is up to you. All of them are effective, so discuss this with your doctor and do some research so you know what you are getting yourself into. Each of these is painless, so just relax and let the professional do the rest. Just like conventional medicine, don't expect an improvement overnight, as this takes time, so just keep an open mind. Different types of acupuncture needle. Are there actually different types of acupuncture needles? For the majority of people undergoing acupuncture treatment, a special acupuncture needle will actually be used. These needles, although they resemble common needles that you may have seen in other places, are actually designed specifically for acupuncture needs. While there are other types of acupuncture available, including electroacupuncture and ear acupuncture, needle acupuncture is still the most common form, and is the most practiced type of acupuncture around the world. This can likely be attributed to the low cost of the needles in comparison to the expensive electric machines that drive electroacupuncture. For traditional acupuncture, there are 9 different types of acupuncture needles. However, as times have changed and needs have been modified, only 6 of these 9 needles are actually used in modern acupuncture practice. The acupuncture needle is designed to come wrapped in its own sterile package to keep infection rates down, although all of the needles are sterilized and disinfected after use for use on subsequent patients. One of the most important features of the needles used in acupuncture is the size. Acupuncture needles come in a variety of gauges and lengths, all of which are used for unique purposes. For example, deep acupuncture requires longer needles that must be inserted much further into the skin. Furthermore, the needles need to be a size and shape to allow them to be inserted easily, and painlessly, into the patient's flesh. Although we often think of acupuncture as simply involving the use of needles, there are other practices that can assist the process as well. During treatment, the needles may be tinkered with, raised, lowered, twirled, plucked, or scraped against the skin to enhance the healing process. The type of acupuncture needle used in such techniques is the same as any other acupuncture needles that you may have already been stuck with. Thanks for watching. Please also pay attention to the description.
You